Good afternoon. I'm Lynette Roach with Black Health Matters, and welcome to the Science of Healthy Hair session. Manipulation of the normal structure of the hair shaft is epidemic and dictated by culture, fashion, and above all, celebrity. Loss of luster, frizz, split ends, and other hair problems are particularly prevalent among people who repeatedly alter the natural style of their hair, or among people with hair that is intrinsically weak. Hair health is also affected by common afflictions of the scalp, as well as age-related phenomena such as graying and androgenetic alopecia. We'd like to welcome today Dr. William Yates. Dr. William Yates has had a passion and drive for excellence his entire career. Dr. Yates specializes in treating all hair types for both men and women. He utilizes state-of-the-art options such as PRP, or platelet-rich plasma, and stem cell therapy. He is a national expert and teacher and author, performing the minimally invasive technique for hair transplantation, FUE, or follicular unit extraction. Dr. Yates has also researched and developed an all-natural hair care line for every hair type, including problem or thinning hair. Please join me in welcoming Dr. William Yates.
Thank you very much for that most generous introduction. I'm based in Chicago, and I didn't start off being a hair surgeon. I started off being a cancer surgeon. And it was always very curious to me at all the meetings after women had had a mastectomy, they were more concerned about losing their hair sometime than they were about what had just happened to them. And that kind of piqued my interest in hair care. I switched to being a hair transplant surgeon in 2005. So I've been doing it for over 15 years, and I know what works. I know what doesn't work, especially with our hair. And Chris Rock did all of us a favor in 2009. He made the movie Bad Hair. And what he let us know really is that as African Americans, we don't have control of our destiny of our hair. There are so many myths out there about what works. And we're going to go through some things that work, and I'm going to go through some things that I think don't work. So you might think they work. So let's go through our journey. Black hair matters. Next slide, please. So this slide's boring because all you have to do is live long enough and go to school and read some books and you will do things. So this just shows that I'm old. So next slide, please. So what everybody wants to know is how bad is the problem? Because a lot of people always ask me, they say, Dr. Yates, women don't lose their hair, right? It's just a man problem. You know, Michael Jordan, right? And men look sexy bald, but women don't look good bald. You know, those are obvious conclusions, but the reality is that about 40 million women lose their hair every year, starting at about age 30, it starts to thin. The same with men. And there's been recent articles that have shown since COVID-19, and this works with every disease process as far as how Black people are. Whatever there is a disease process, we get the worst of it. So not only do we contract COVID more and have more illness, we also lose our hair more from COVID. Now, the good news is once you recover from COVID infection, after 3 to 6 months, that hair will come back. But there is an article out that you should know that Black women lose more hair from stress or from COVID than our Caucasian counterparts. Next slide, please. Now, what's very interesting about African hair is, in the hair world, we call it Afrocentric hair or Afro-Caribbean hair. And always, everyone, when I first started out, people would say, well, Dr. Yates, Black people don't go bald. I've never seen any Black man bald. I mean, really bald. White guys go bald more. But the truth of the matter is, as far as women and as far as men, we have the same statistics. Now, I'm going to tell you somebody who does not go bald. These are Native Americans. So if any of you have ever traveled to the Southwest, like say Albuquerque and New Mexico and states like that, and see Indians, and I've been there, I have never seen a Native American who is bald. Now, some of these vitamins that you're going to see that they've based this on have used this as a pre-thought. But I think that these people aren't bald, not because they're eating whatever, purely genetics, as we're going to see. So the thing to know, African Americans go bald and lose hair as much as any other race, except who? Native Americans. Okay, next slide. Now I'm going to show you a picture of all those three handsome men on my left side, on your right side. The one in the middle, that's me. I'm going to say 25 years ago, because that's me with the glasses. That's my father with the red coat. And the gentleman on the right or on your left is my son. And he was an athlete at Northwestern. He's now in business school. But just to show you, this is what my hair used to look like before I had a hair transplant. So like Cy Sperling said, I'm not only a customer, I'm not only the president, I'm a customer too. Everything I say to you, I believe in because I've done everything. So let's advance. So I just want to show you that that's how getting a hair transplant really changed what I did. Now I want to say one more thing. Before I had a hair transplant, I did all the oils, all the things you hear on the internet, everything your grandmother tells you to do. And you know what happened? No hair grew. And there's a reason for that. Now, why do people lose hair? Now, it depends on who you talk to, but if you talk to a doctor, there's really only one reason people lose hair in massive quantities over time, and it's genetic. And it's a word that doesn't sound good, androgenetic alopecia. And all that means is that the hormone that makes a man look like a man makes your hair thin. Women have that hormone, so it can make their hair thin. So in my practice of the men I see, almost all of them have genetic alopecia, whether they're black or white. The women I see, almost all of them have genetic alopecia, whether they're black or white. Now, there's something we're going to talk about, which is very prevalent in the African American community. It's called traction alopecia. Everybody talks about their edges. There's a lot of misconception going on about the edges. So we'll talk about the edges. Scarring alopecia, that's the alopecia kind of in the back. Very difficult to deal with. And now I see a lot in women have autoimmune disorders. They have lupus, polymyositis. Anything with these itis words on it can make you lose your hair. So let's advance and let's see what we're talking about. Let's talk science now. Next slide. What you can see here, just to show how the hair follicles differ between black hair, Caucasian hair, and Asian hair. The one furthest to my left or to the right is a Caucasian hair. The follicle you can see is straight. The root is straight. Everything's straight. Asian hair, little tilt. Our hair is completely curly. Now, the problem with our hair being that curly is basically one problem is it does not grow as fast as everybody else's hair. Caucasian hair grows about ½ an inch a month. Our hair grows about half of that. So always people are worried about, they're saying, my hair just won't grow. That's not true. African American hair, Afrocentric hair, the growth rate has been proven that it is much slower than Caucasian hair or Asian hair. Asian hair grows over ½ an inch a month. It grows fastest. Now, as far as density, even though sometimes our hair, if we wear an afro, it looks really thick, our hair is less dense, meaning if you took an inch of our hair and counted each hair in that inch, our hair is less dense than the average white person's hair when they're, say, 20 or 30 years old. Our hair just looks thicker because it's curlier. And there are a lot of reasons why people say that our hair is curlier, or scientists, because we never want to talk about people. We want to talk about science. And the science of why our hair is curly basically centers around two factors: geometry and geography. Geography, that most of us, our ancestors, came from sub-Saharan Africa, and the curliness of the hair blocks the UV light. And UV light actually will cause skin cancer. The other thing is the curliness of the hair locks in a lot of the moisture when we sweat, so we don't lose that moisture and overheat. Those are the two factors that have been theoretically shown why our hair is curly. Now, they've tried to identify a gene that shows that our hair is curlier than somebody else's. They have not identified that gene today. Next cycle. So, knowing that our hair is very curly, and it's curly for geographical reasons, because the sun doesn't destroy our scalp, and so we can preserve our body heat and stay cool when we need to. Knowing that, what you have to know is there are 3 cycles of hair growth. Most of the hair on our head, 80% is an anogen. What does that mean? That means 80% of the time, all our hair is growing. Okay, that's good. And the other 10% of the time, or 15 or 20%, it's in catagen or telogen. Now, why this is important is because I want to show you, when you comb your hair every day, you'll see in the comb you're going to lose some hair. Okay, that's not a big deal. Everybody loses about 100 hairs a day. That's the telogen cycle. So what's happening is most of your hair is growing, but 10 to 15% of your hair at any one time is shedding. And so when you comb your hair, that's the hair that's in your comb. If you don't have the gene for baldness, guess what? Your hair will grow back. So don't freak out when you comb your hair and you see a lot of hair in your comb. I remember I used to have a big afro. I comb my hair, so much hair in the comb. And when you're a kid, you never think about it. But that's all telogen hair. It grows back. It's only a problem if you start combing your hair every day and there's more hair in your comb and it never grows back. Then we have something to talk about. Next slide, please. So let's just talk about some basic things about, now that you know the structure of African American hair, Afrocentric hair, what are the things that would harm our hair? The number one cause that we lose our hair is breakage, like say a stick, like just snapping a stick. And I just brought a stick from the outside here, if you can see the stick. Even though our hair is so curly, the sweat gland, which is at the base of the hair shaft, tries to get up the hair shaft, but the hair is so curly that oil never makes it throughout the hair shaft. So what happens is, just like in nature, it'll just break. When you comb your hair, it breaks. It doesn't break because our hair is weak per se. It breaks because we don't have enough oil in our hair to permit that combing. So you say to yourself, well, how often should we wash our hair? That's the first question always I get asked. You should wash your hair as often as you need to, meaning the best sign that somebody's hair needs washing is that their scalp itches, because when that happens, you need to wash your hair because there are toxins building up beneath your scalp, which actually need to be cleansed away. Now, if that happens once every week, once every 2 weeks, that's perfectly okay. Like, as we know, Caucasians and others wash their hair every day. And why do they do that? It all goes back to the sweat gland. Their sweat glands produce so much sebum, so much oil, that their hair gets stringy, and they have to wash it every day to get volume. When you wash your hair, this is something a lot of people don't know, you're really washing your scalp. It's like the hair on top of your head, you're cleansing that as well. But I'm just going to tell everybody this, and a lot of people are like, oh, no, that can't be true. All the hair that's on your head, all this hair that's sticking up, this is all dead, okay? All the action, the live portion of your hair is beneath your scalp. And that's how it works. So there's a little every day. It's like a factory, and it pushes up the live portion, which pushes up the dead portion. So the longer your hair is, that hair shaft is not living. And the way you can prove it to yourself, every time you get a haircut, it doesn't hurt. Anything that has life has nerves on it. It will not hurt. So my point being that you don't need to wash your hair every day. You'll know when you need to wash your hair when you get oily buildup of your scalp, and then just wash it. Okay, so something else unique to our hair that a lot of people have used forever because we want to change the texture. And even though the hair on the outside of your head is dead, it is not alive. So you have to understand that. It still has structure. It's like protein. Like a good way to understand it is like if you eat, say, a piece of broccoli, that piece of broccoli is not alive. It's been cut off from its circulation, but it still has structure and protein, okay? So let's talk about relaxers. Relaxers have been around a long time, and they are chemicals that actually break the bonds in the hair. Next slide. So what a relaxer does, you see how this green, in the middle, you see the white. Those are sulfur bonds. So there's sulfur and hydrogen bonds that are holding each strand together to kind of make it curly. A relaxer goes in there like a bowling ball and breaks through it. And of course, there's lye relaxers and there are no lye relaxers. Generally speaking, it's better to use one without lye because it's not as harmful. It's not as strong. You might have to repeat the process more, but no lye is better than lye. If you use a no lye relaxer, sometimes it'll leave your hair with what we call calcium deposits, and you might have to wash your hair more, but still in general, it's better to use a no lye than a lye. Now, there's another way to break those bonds, because all you do when you break those bonds, it's like a slinky. They're like a bowling ball. You stretch the hair out so it looks like Caucasian hair. You can do it with a relaxer. Heat can also break those bonds with enough heat. And we're talking about heat up into like 200 degrees. Some of those combs get almost to 300 degrees. Now that's a lot of heat to put on your hair, and we'll talk about that later. But there are the ways that you alter the structure of ash-fluorescent hair is with relaxers and heat. So just remember that. Okay, next one, please. So let's just talk about some things. Say you're losing your hair. We haven't gone through all the mechanisms, but let's talk about what's FDA approved. And it's just like now with all the vaccine talk, everybody now is about FDA. So FDA approved, Rogaine, that's minoxidil. It's FDA approved to regrow hair. It usually takes 2 to 3 months for you to start to see it work, but it works. Now, you'll have to use it every day because people will say, I don't want to use it every day, but I want my hair to grow, so forth and so on. And then I will say, well, that's wonderful, but it's no different than brushing your teeth. You brush your teeth every day and no one complains. And if you don't brush your teeth, we all know what happens, right? It's not good. So then there's what we call laser. Anytime you fly now and you go on the in-flight magazine, you're going to see laser caps. Those have been FDA approved if you wear them every other day to regrow hair. Then there's a medicine called Alopecia that's mainly used in men. It's a hormone modulator and it grows hair back in men. And it's also used in postmenopausal women because you don't want to use it while you're childbearing. Now, these are the only things out there in the billion-dollar industry of hair care, whether you're black, you're white, or you're Asian, that have been proven to grow your hair back, okay? In studies that made it FDA approved. Everything else is not, okay? So let's go on to the next one. Let's talk about over-the-counter remedies. When I was growing up, and my family, my grandmother's from the South, from Mississippi, and she'd make it very clear. There are only 2 things that you could do for your hair, pills and grease. And as all of us know, there are a lot of grease and creams and salve, and everybody has their favorite. Every hairstylist has their favorite for whatever reason, and we're going to discuss basically why this works. Now, I'm just going to give you a spoiler alert. The reason that all these greases for our hair works is back to that breakage phenomenon. Because since the sebum cannot travel up that spiral, by us putting grease on our hair, whether it's bacon grease, whether it's butter, shea butter, or anything, I'm going to say it's going to help reduce breakage to allow that hair to grow. Now, as far as vitamins, let's talk about vitamins. Let's go to the next slide. Okay, now you might say, what on earth am I showing here? These are the common ingredients in hair vitamins. You'll see if you start reading hair vitamins, you'll say marine complex number C, marine complex, meaning coming from where? Aquatic life. So, and the reason they put that in there goes back to what I said about Eskimos and Native Americans. They've noticed that people that have thick hair usually will have a diet high in amino acids, which are found in fish. So they put some of that in the vitamin. The other one, sand, silica. They put silica in vitamins, you know, to give strength to the hair. The other one, iodine salt. They put iodine in vitamins and claim that that's what grows your hair back. And then the other things they put are vitamin C and, of course, something called vitamin B7, which is biotin. That's in all these vitamins. So let's go to the next slide. So of the vitamins that my colleagues always have patients on are Viviscal and Nutrafol. And I'm going to tell you right now, I don't work for any of those companies. And a lot of the studies that they've done, if you're a real scientist, you'll just go through them and say they make no sense. Even though they're double blinded, meaning you don't know what side you're on. You don't know if you're taking the sugar pill or the vitamin. They're still not good enough studies to prove that these things work. Now, in both of these vitamins, all they carry in them are the things that I showed to you. They have silica, horsetail extract, and horsetail extract doesn't actually come from a horse, but it's actually a herb, and it theoretically can grow back hair. But there have really not been any studies, which, like when we're studying, think about the vaccine. They studied that in what, 30 to 40,000 people before they let it loose. These vitamin companies have studied these vitamins in 40 people, 70 people, and then they have studied them in people ages 12 to 70. Now, common sense will tell you somebody who's 12 is not going to have the same problem in constitution as somebody 70. And they compared these same people and said their vitamins regrew any hair. Now, as a scientist, most scientists would say that makes no sense whatsoever. So what I'm saying as far as these vitamins, I don't think they're going to make a difference whatsoever, and they're not FDA approved. So next slide, please. So I don't like my patients to get caught up in thinking a vitamin is going to be the answer. And I'm going to tell you why. If a vitamin were the answer to hair loss, I would not have a job, because vitamins are ubiquitous. You can get vitamins everywhere. And vitamins just will not answer the cause when you have a real problem, okay? And a lot of the claims are not scientifically done, even though doctors support them. Just because doctors support them doesn't mean it's correct. They're not FDA approved, and I don't believe they grow any more hair than a Flintstone vitamin. That's my personal proof there. And I do suggest that everybody take a multivitamin. But in the United States, most of us eat a diet where we're not depleted in vitamins. We're not depleted in biotin. So next slide, please. So I always talk to all my patients, and I want to know everything. I want to know what you eat. I want to know what your grandmother told you, what your hairstylist told you. What did they tell you is going to grow your hair? And you know what I hear more than anything here in Chicago, or even when I had an office in California, especially for African-American women, they said they use Dr. Miracle on their hair. I said, why do you do that? And they said, well, because, you know, he does a miracle and I put on my edges and so forth and so on. So guess which one of these men on this picture is Dr. Miracle? It's not the one on the right. That's George Washington Carver. Dr. Miracle is the fellow with the t-shirt right there. That's the miracle that has provided help for your edges and things like that. And that's not to slight him, but I do think it's a bit deceptive, you know, for what's going on. Like Chris Rock has said, we don't really have control of our destiny. Do I think his products are a cure for anything? No. Let's go to the next slide. most of his products, like anybody's products, if you understand them, the oil is to protect or lubricate the scalp from breakage. You could put any oil in there. And I know everybody has their favorite oil, but I think in general, the whole with the Miracle Foundation is more it's exploitation in my mind, just like Chris Rock said. And everybody has to really understand things like that and really understand what these products do. Next slide, please. So in general, if anybody has to say, well, what as African-American people, what should be the main thing we should be worried about? Number one, we should be worried about oiling the hair shaft. And I've told you before, explained to you, the hair shaft is dead, but it's just like a branch. If you take a branch off a stick, it still doesn't feel dead, but it's dead. But if you don't oil it, it will snap. So oiling is very, very important. Shampoo, should you use a very detergent shampoo? Stay away from, the heavy detergent shampoos, the sulfated shampoos. I'm a total believer in that. Natural shampoos, gentle shampoos, shampoos that have anti-inflammatory components like tea tree oil, olive oil, things like that with oils. Yes, that's what I think you should do. Do I think there is a secret sauce that will regrow hair in Afro-American people or Afrocentric hair? I do not. And there might be a lot of people listening now that say, well, my grandmother's remedy, and don't you remember Madam C.J. Walker? But you know what the problem with all that is? Everybody's hair situation is different. No two hair situations are alike. You can have two young ladies grow up, eat the same food, whatever, do different styling practices or the same and have different outcomes with their hair. The other thing that we have to stress, because in the textbook with African-American hair, there's always an emphasis on our styling practices. And the reason that is because that's the easy out. There's really been no research or enough research into why African-Americans lose their hair. If you watch TV every night, what do you see? 50 commercials with medicines for psoriasis and how to make your skin better. And there's a reason for that, because people are interested in psoriasis and want to pay for their treatment and so forth and so on. But there are just as many people interested in African-American hair loss, but there are really no approved medicines to treat African-American hair loss. So as far as styling practices, a lot of the authors, which are not African-American, will kind of use this as a scapegoat. And they'll say, well, it's because as African-Americans, you relax your hair, they used to call it hot comb alopecia because you would take the comb and straighten your hair and it would make your hair fall out. That's true and not true. If you don't have genetic hair loss, yeah, it'll break that hair off from the heat, but the hair should grow back. So that's not the real answer. Hair vitamins, are they the magic cure? No, because if they were, like I said, I wouldn't have a job. Let's go to the next slide, please. There's some new medical treatments that I want to mention that they're not FDA approved, but we still do it. Platelet-rich plasma. What we do is platelets are a part of the blood system that carry growth factors. So we take your own blood, a little tube of it, we spin it, take out your platelets, and inject it back into your scalp because the platelets have growth factors in it. When you cut yourself and you heal yourself, the platelet growth factors are responsible for that. So we take these growth factors from your own blood and put it back in your scalp. And we're having great result with that. It's still not FDA approved, but a lot of women whose hair is thinning, we use it all the time, like once a month. The other thing is something we do stem cell therapy. Stem cells, state of the art, still not FDA approved. And stem cells have a lot of growth factors in them as well. And these stem cell growth factors go to your hair follicle and stimulate your hair follicle to regrow a hair. So stem cell therapy is something that you should consider wherever you live. Just look it up. We do it here. It's very safe. Either the PRP or stem cell therapy takes about a half hour to an hour to do. and you start to see results in 3 to 4 months. Now, these other things, micro-pigmentation, that's actually putting pigment on the scalp. We'll show you that. Scalp micro-needling. A lot of people do needling of the scalp. And you take like hundreds of tiny little needles with like a roller ball and roll them over the scalp, and that induces micro-injury, and your body secretes their own health factors and growth factors to regrow hair in that area. So we'll talk about that too. But let's move on to some other things. As I always say, more hair is better. Not to say that not having hair isn't, but I think more hair is better. We're going to take a look now at mainly what I do, transplantation. Let's look. You can see over here, that's a picture of me not too long ago. This is a picture of me when I was 29 years old over there, and my hairline was in the middle of my head. I had a hair transplant. That's another reason I'm totally passionate about it. It's not a wig or like you'd see on the late night commercials. It's your own hair and it grows. Next slide, please. Some men, what hair does for you, it provides a frame of the face. So you can see in this picture here, that looks great. See the frame of his face. Next slide, please. Now that's Michael Jordan, but you don't see the frame of his face. If he had a frame of his face, I guarantee you he would look better. I'm not saying it looks bad, but hair always looks better. Next slide. And we can see, and these are all the young people. This is a famous rapper. Somebody put this on Instagram. That's not a very flattering style. More hair is better. Next slide, please. Hair frames the face. And the reason that people go bald, whether you're a woman or a man, is because the hair on top of the head is different genetically than the sides. Like the George Jefferson look. That hair on the sides is genetically immune to the balding process. That's the hair we take for transplantation and move it to somewhere else. Next slide. You can see here in females, the patient that you see on my left or your right has traction alopecia, or that's the edges problem. Now, depending on how bad it is, just putting oil, I don't care if you use Dr. Miracle, Dr. Triple Miracle, Dr. whatever, or even my formula, it will not grow it back once you've done damage. That's severe. Next slide. So the main things that we worry about with African-American women, there's always usually an underlying theme of genetics, then there's traction, and then there's scarring, okay? And always, if you see somebody who doesn't really know about African-American hair, they're gonna blame it back on you. They're gonna say, you braided too tight, you used a hot comb, you used relaxers when you were young. They're gonna blame it back on you. But I'm gonna tell you now, a lot of times it's not your fault because we're finding their genetic components and genes for scarring alopecia, which is the worst. Next. This is what scarring alopecia looks like. It's usually in the vertex of the scalp, and a lot of women who have this condition usually come in wearing wigs, and it usually starts with itchiness and hair loss. This is probably the worst one that can happen because you have an inflammatory response under the skin, which is actually like a little Pac-Man eating your hair follicles. So these hair follicles will not come back. So when I see something like this, first thing you want to do, we biopsy it, take a little tiny piece to make sure we know what's going on. And then we have to stop the inflammation so it doesn't spread. Next. This is the same picture. This is from the top. A lot of people, are wearing braids and in denial that this is really happening. But this again, scarring alopecia, it's called CCCA. It's a fancy word, you don't have to memorize it, but when you see it, just know it means scarring alopecia. Next slide, please. This is kind of a gestalt of everything that I see with African-American hair. The edges usually start as traction alopecia, but traction can move into scarring if you don't treat it. And traction alopecia is thought to be from just the pulling and the tightening and things like that. But you do not, the word scarring alopecia, you want to prevent at all costs. Next one. Next slide, please. Yes, sir. Now, how do you treat scarring alopecia? Scarring alopecia in the hair world is an emergency because you do not want it to spread. It's like a a little Pac-Man under the skin that starts little and spreads out. That's why they call it centrifugal, or centrifugal. It spreads outward. So the way you do it is you either inject steroids, give them antibiotics, or some of those medicines that were used on those psoriasis commercials, but you have to limit that spread as soon as it starts. You can't ignore it. There are no oils. There's no Dr. Miracle. There's no Dr. Yates formula for that. You need real medicine to stop that. There's some tricks that we do once it's stopped. Yes, you can transplant it or do micro-pigmentation. Next slide, please. Traction alopecia is a little better situation. Usually, this is what women talk about with their edges. Usually it's from braiding too tight, or or wearing these styles over a long time. But I think there's a genetic component to that, because I've seen 2 patients wear the same hairstyle all their life as best friends. One comes in looking like that. The other comes in with nothing going on. So when we see this, we don't want this to turn into scarring alopecia. So we start minoxidil. We start all those other things like PRP. We also can do exosomes, which is part of the stem cell therapy. This also can be transplanted. Next slide, please. But you don't want that to get to scarring alopecia. Next slide. Hair transplants. We can go to the next slide because I'm going to speed up some things. The difference between hair transplants, when you see hair transplants on TV, the straight follicles are Caucasian follicles. Our follicles are more shaped like a Cheerio. So to be able to do a hair transplant on an African-American person, you have to be 3 times as good as to do it on a Caucasian patient. That's just the truth. Next slide, please. Next slide, please. This slide might freak people out. This is an old way that it's done, where you take a strip of hair out of the back, that George Jefferson puff, whether you're a man or a woman, and then you sew that area up, that the person gets a scar, and then you dice up the hair and put it where you need it. Next slide, please. What that leaves you with is a scar in the back of your head that doesn't look good, whether you're a man or a woman. Next slide, please. This is what people used to think of as old hair transplants. It doesn't look like that anymore, if you know what you're doing. Next slide, please. This is just the difference to show you if you have it the old way, that's called FUT, or the new way that I do it in men and women called FUE. We punch out each hair individually. You can wear your hair low. Nobody knows you had it. And it's a beautiful thing. Next slide. The thing you have to know about black hair versus white people hair, our hair is less dense. That's all you need to know. It looks more dense. Why? Because it's curly. Next slide, please. Next slide. We can skip over that. And this is the way the hair transplant is done. That little instrument goes down over the hair follicle one by one. I do it by hand. It looks like a little dental instrument. One by one, punch out some hair in the back. Your hair in the back gets a little thinner. We say we rob Peter to pay Paul, but the benefits you get up front are so great. It's just, as I say, it's priceless. Next slide. Yes. So what we're showing here, just in men and women, that bozo rim hair, those little dots are, that's where we take hair and move it to where you need it. Next slide, please. So this is when we have tough cases where we don't want to do transplantation. This is scarring alopecia proved by biopsy. So what we did PRP to try to limit the spread of inflammation the best we could. After that was done, we did micro-pigmentation. And it gives a great result in somebody that doesn't want to have transplantation. So you see on the right-hand side, she has micro-pigmentation. Nobody can tell, looks beautiful, micro-pigmentation. We do that in 2 to 3 hours, and it lasts. Next slide. Traction hair transplants. You can see the one on my left. You can see that's mild traction alopecia. We put grafts in. It works beautifully. We took it from the back by the little method I showed you. It takes 6 months to grow. In traction alopecia, it almost always grows. Scarring alopecia, since the skin is scarred, it takes 50%. So that's why we always want to treat scarring alopecia quick, fast, and in a hurry. Next one. Here's another one with traction alopecia, kind of in the hairline, from wearing different styles, pulling your hair back. Here's another one we punched, and traction works beautiful. When we see traction and somebody's tried Rogaine, PRP, so forth and so on, and they say, hey, Dr. Yates, I just want some hair, we go right to transplant. Looks beautiful. Next one. Same thing. This one had traction alopecia in the hairline. You can see the little dotted line. That's where we moved her hairline up to. So can be done all day as long as the scalp is healthy. And you can see now her forehead looks half the size it was before. We do it all the time. Where do we get the hair from? Same, in the back. The hair in the back's better. Next slide, please. Here's another traction. Just wanted to show that I'd say 50% of my practice are females. The traction alopecia, you can see the difference. Still, you can see a little area of lightness there, but in my mind, that's night and day. Next. Here's another one. It's harder to see, traction alopecia in the front and going to the back. We kind of redid the hairline. Again, where's the hair come from? The back to the front. If you saw the back of her hair, it looks great. Can't tell. Next one, please. Now, the other trick is hair fibers. Now, hair fibers, it's a trick that it's so easy. Like if you have an area that's thinning, you just sprinkle hair. We make special hair fibers for the African-American community because they have sheen to them. Next slide, please. They don't, you can see the difference that when the lady puts the hair fibers in, how much thicker her hair looks. Next slide, please. And it's easy. And all you do, it washes out with shampoo. You don't have to apply it every day. It doesn't clog your pores. It doesn't harm anything. It's not cheating whatsoever. And it's cheap. And you can, if you have a little thinning up top, I use fibers all the time. Just sprinkle them like that, and it doesn't come off on your clothes, and your hair looks thicker. I see there's no reason in the world why you shouldn't be using these fibers, at least. Next slide, please. And you can just see, next slide. You see everybody's just like this. Her hairline is compromised there. She could have had a hair transplant. She was a student. She didn't want to, so she wanted to do fibers. No problem. We can still do a transplant whenever she's ready. These fibers are not hair. They're just ground up protein. And as we know, the protein is dead and it's dyed, and you put it on your scalp, works like crazy. Dr. Yates hair fibers. It has a sheen to it so it doesn't look dull as some of the other fibers do. Next slide. Men use it all the time. Next slide. Now this is something that I see, and I want everybody now to really watch TV tonight and look at all the news anchors. Look at their hair. A lot of them, I can guarantee you, their hair looks like the guy thinning, but all of them use fibers and they line it up. And you can always tell. I can tell if they're using mine too, because if they're not using mine, it looks very dull. But start to train your eye to look for fibers. They're everywhere. So you should use them. Use fibers. Next slide. Scalp micro-pigmentation, a great trick. You know, when you're losing hair and for some reason you don't want a hair transplant, but you want to have that look, whether you're a man or female, we do it on women too. You can see it. This gentleman's an actor. All you want to produce is that little light ball fade. Next slide, please. You can see in this gentleman here, he really wasn't a candidate for a hair transplant because he didn't have enough hair in the back. So we did micro-pigmentation. Beautiful. Next slide, please. And start, when you watch TV too, look for a lot of guys with micro-pigmentation. It's all over the place. You can see that too. Just keep looking, because micro-pigmentation will always look just a little duller and just too perfect. Hair doesn't grow like this. This is just to show men. We transplant men all the time. Next. These are all men that we've hair transplanted. Next. Now, everybody knows who this is. That is not a normal hairline. People, you know, a lot of guys come in and want a hairline like that. That's not normal. And you can see he has a tattoo in the back of his head. Nobody would normally put a tattoo there. So what is that telling me? He had a hair transplant the old way with that big scar I showed you, and to camouflage it, he put a tattoo. That's my guess. I don't know if it's true, but his hairline, if you look at his pictures when he was in living color and compared to that picture, call me up and tell me, you can tell me what he did, because they don't look the same. Next slide, please. These are just hair transplants, just to show it works on men. Next slide, please. Next slide. And I don't need to say much about that, but you guys, since I've told you the things I've told you, you should be able to figure out what's going on there. Next slide. And this is a common scenario for men. Next slide. This is just to show you, when you see commercials, the difference, the thickness between white hair, Caucasian hair, and black hair. They never show that you can do black people, but you can, and we do it well. Next slide. You'll see this all the time. These are my patients, but the other pictures are just to let you know, when you do it right, you go to the right place, it looks great. Next slide. And this is me on the set of a TV show, because everybody wants to know about black hair and white hair. And this one, they didn't want to know about black hair, but I told them a little bit about it anyway. Next slide. So what I really want to say, and I don't want to be cynical, that as far as hair products go, basically all of them are the same. I think you should really go for natural products that have some element of science to them, that reduce inflammation. Tea tree oil, things like that, that have tea tree oil, saw palmetto, have biotin, things like pumpkin seed oil, things that have been studied. Now, I haven't been studied like they're studied in a hospital, but they have some data that suggests that they're good. But as far as these fancy products that you reorder every month, and those vitamins that basically have those things I showed you in them, I think that, it's good, but I think you're wasting your money, because think about it. Think to yourself, if it worked, don't you think everybody on earth would be taking those vitamins and nobody would care? So way more complicated than they're making you believe. So I think I have a product line, and I'm not promoting my product line more than anybody else, but to say that we've centered on things that are common problems in our community. So the edge control, the oil, you can use it all over your hair. It has Jamaican black bean castor oil. Now, is that oil in itself the secret sauce? No, but that is an oil that works. So why not use an oil that works? If your hair is thinning badly, you need to see a specialist. That oil will not help you. We have special shampoos with apple cider vinegar, which restores the pH of your hair down to where it should be. We have heat sprays that actually protect your hair when you use heat. A lot of people don't use relaxers. So when you use heat, we have what we call a blowout protector that holds those bonds together. You won't injure your hair. So check out our website at dryatesethnichair.com, or if you're in Chicago, come see us, or we're also under yourhairlossexpert.com, and we'll talk to you all day about hair. But I'm in total agreement with Chris Rock that African-American hair, I think, is the most exploited brand of hair and type of hair there is out there. So I'm here to help. Thanks a lot.